So the key cause of iron deficiency is heavy menses. If you have heavy menses, you would lose in a year as much blood as you would for an open heart surgery.
Hi, welcome to PWRMUMS Podcast. Today we're joined by Heike, who is the co-founder of the Iron Suites here in Singapore. Welcome to the podcast.
Thanks for having me.
Thank you for coming. Would you mind introducing a little bit about yourself and about the Iron Suites as well?
Of course, no problem at all. My name is Heike. I'm the co-founder of the Iron Suites Medical Center. I'm German, as you might hear. I founded this clinic, the Iron Suites, together with my husband. And the reason why we did it is basically my own pregnancy.
Okay.
When I was pregnant with my number one, I was walking to work. He was walking me 1.5 kilometers, and I was walking and talking, and I was really out of breath. In the end, I had to stop in between and take a deep breath. And then we realized, oh my God, what's happening? My husband is in the field of iron deficiency management for about 20 years. So he was like, okay, we check your ferritin. Something very important. If anything we remember after today, it's just the ferritin.
Take home message.
Ferritin is the key thing.
Yeah.
So we basically got our doctor to check the ferritin. I started my pregnancy with levels over 100 serum ferritin, which is optimal to start your pregnancy at. My husband, being an iron expert, he obviously made sure that I started my pregnancy like that. It dropped to 28. Anything under 30 is absolute iron deficient. So like, okay, that's good to know. What are we going to do? And we said we would like an iron infusion. And it was a bit difficult to get it from the doctor at that time. So we flew to Australia, and a friend of my husband gave me an intravenous iron infusion, and it made a world of difference.
Okay.
So basically after 48 hours after the infusion, we went for a 10-kilometer beach walk, walking, chatting, having a great time. And after that we stopped, and my husband was like, oh my God, did you just realize what happened? I was like, oh wow.
Yeah.
I did not have to stop once to catch my breath. I was talking the whole time, which he always jokes about. But it was fantastic, made a big difference. And then we thought, okay, we're really onto something. This really makes a big difference. We've seen lots of medical papers, but feeling it in person, we want to make it accessible to more women. And that's kind of how the whole idea was born, to set up the Iron Suites.
Yeah. And now we are sat at the Iron Suites.
Exactly.
And I just had my infusion. And it was pretty quick, pretty pain-free, and yeah, I'm feeling pretty good. Would you mind talking through your typical client, your typical patient at the Iron Suites?
Yeah, so I'm basically coming to what the key risk factors are for iron deficiency. It's being female.
Okay. Check.
Check, exactly. So the key cause of iron deficiency is heavy menses.
Okay.
So we have an interesting questionnaire you can find online, etc. Feel free to repost it. If you check more than 2 of these boxes, that basically means you are prone to heavy menses, because it's not something you sit with your girlfriend and say, oh, how much blood did you lose last month, right? It's not something you really talk about, but there's the medically validated questionnaire, and just if you have heavy menses, you would lose in a year as much blood as you would for an open heart surgery. So it's almost about 1 liter of blood you lose a year, which is as much, as a serious operation.
Yeah.
But we don't do that once in our life. We do that every year we go through. So that every milliliter of blood is 0.5 milligram of iron. So that's quite significant. The other significant, event in our lives, that's why we're here, is being mums, which is beautiful and a great experience. But every pregnancy takes about 1/3, meaning 1,000 milligram of iron out of our body. And that's obviously what goes to baby. The first 6 months that goes to baby is purely coming from your body, comes from your stores onto baby. So we're giving them the stuff. They're really like, everything, not just the iron. We're passionate about nutritional health overall, because it's all, it's all interacting with each other. Iron, however, is quite essential, because you have iron in every cell of your body. Okay. It's not just important for hemoglobin, basically the ability to transport oxygen around your body, but it's also very important because it's in every cell. I'm not sure if you remember the Krebs cycle from your studies.
But just remind me for the viewers at home.
So basically, in order to utilize the oxygen and create energy and create hair growth, all these things, you need iron. And iron is part of the process. So if you don't have iron, you have all this oxygen transporting around your body, but you might not be able to utilize it. And iron is is absolutely key to support your immune system and to be healthy and fit. There's always this one lady in the office that gets sick all the time.
Yes.
You can almost guarantee that she's probably the one that's iron deficient.
Okay.
So yeah, the key reason, coming back to your question, is being female, having heavy menses, having gone through pregnancy or being pregnant, especially when you've just had a baby and literally they sucked everything out of you. And
just not the fat, unfortunately.
No, not the fat. Like your levels that you were now, if you don't mind sharing what you were.
Let's share. They were terrible. They were 10.
Yes.
My ferritin was 10.
So your ferritin was 10, was quite low. So for you to get up to, in an ideal world, we want patients to be over 100 to be fully functional. Hair loss starts at levels of under 70. So in an ideal world, you would be over 100. To get up there, it would probably take 6 to 9 months.
Okay.
Can I give you an interesting example? I actually use my water glass here, which is a nice example. So imagine this is your iron storage in your body. In an ideal world, a woman would be having 3,000 milligram of iron. A man has probably more like 4,000. And you take in 1 to 2 a day, and you lose 1 to 2 a day through cell shed, sweating, etc. So you cannot make or destroy iron in your body. So you take it in through food. So what happens is you take 1 to 2 milligrams through food. Obviously, heme forms of iron, being fish or meat, are more iron-rich than plant-based. You can get it from plant-based food. You only absorb about 2 to 15% from greens, etc., and you absorb up to 35% from fish and meat. So you get more from other sources. Good to pair it with a little bit of vitamin C, so you absorb it better. However, if your gut is a little bit out of order, your pH level is not quite in place, then you might absorb less. If you take oral iron tablets every day, the really high dosed ones, you only absorb up to 5 to 10% anyway, not more. So all you do is you increase inflammation in your gut, hepcidin goes up, and you stop absorption. So that's how you can absorb, but also can inhibit absorption. The 1 to 2 milligram a day, for us, we lose more when we have our menses. So imagine you have heavy menses, we talked about it, 500 milligram, you lose a liter, 500 milligram. So you only have 3,000, so you're already down 500. So imagine you have, these days we're not having babies when we're 18, we usually have babies when we're more like mid-20s, 30s. So you've had heavy menses for quite a while, so you already start low. So 40% of women start pregnancy on low levels, meaning anything between 30 and 100 is low. Then we have babies. Every baby takes a third of our iron storage, and you go low. And if your absorption is not very good, you go lower and lower and lower. So your tank is almost empty. So if you constantly have heavy menses, you might have to have a top up every 2 years or so in order to make up for the loss. If you have another pregnancy, a third baby, a fourth, you might have to top up again.
Third baby or fourth.
You never know. Or if you're extremely low, in order to get yourself up to normal levels, you might need 1,000 milligram as well, rather than you've just received 500.
500, okay.
So it's very individual. It depends how empty your tank is and how much you need to fill up. It's interesting when we have men coming in, which doesn't happen so often, but we do. It's almost guaranteed that they have some kind of GI issue, Crohn's disease, they're celiac, or any other GI issues. Usually when men are iron deficient, it's not common. They have this great advantage over us. It's why a higher energy level, etc. That's why some moms are like, oh, I can't keep up with my husband. He has so much energy. I don't have the energy. And he's saying, I'm getting so lethargic since I have kids. And it's not necessarily just the sleep and being exhausted from kids. It's quite often you're nutritionally depleted. Your husband, he gave you one great element, which is essential for babies, but he didn't give any of his nutrients in order to make the...
And that's interesting, because when I went to my doctor and she said, well, are you tired, do you have fatigue? And I said, well, yeah, because I have a baby.
Yes.
What's normal, what's not? And I guess then it doesn't matter. If you're tired then and you're known to sort of have had historically low levels, you should go and get it checked. It's worth getting things checked.
It's interesting though with iron, because a lot of women are fatigued and then they put it down and it's 1 to 2 milligram a day you absorb, and you have 3,000, so it's quite a slow process. So sometimes people, become iron deficient over years, and they get a little bit more tired every day, but it's not like it happens today, you're highly energetic, and tomorrow you're super tired. So then they put it down to, I've been working late, my kids have been waking up, I've been doing late emails, and they don't realize that actually the way they can feel. So we realized when I personally realized it, because I had an infusion with Felix, and now with my second one with Mia as well, who's 4 months old.
And super cute.
So I had infusions both times, but with my ferritin, after I had my first infusion with my first, after 10 months of breastfeeding, my ferritin dropped again, and I really felt that my energy levels were lower, but I knew what I could feel like if they're topped up, right? If I'm at my optimum. So I did feel a difference, and we have patients that say, oh, I realized my ferritin dropped. I need to have another top up in order to feel at my best. It's interesting I'm curious to hear what you're going to say afterwards.
Well, and so did you, when you finished breastfeeding, you felt they dropped?
Yes, I did.
So you got them rechecked?
Yes, I did get them rechecked. It's good anyway. We recommend ferritin levels to check for women every year, annually. It's good because there's so much that can happen, right? And a lot of women suffer from gut health issues. So many,
myself included. Like nothing diagnosed, but definitely.
But it's unspoken of. No one really talks about it, and it's also the functional health experts that side that we are looking at, really looking at gut health, because gut is, people now say it's almost more important than your brain, right, to make your overall health complete, and it all comes from the gut. And I had gut issues for the longest time. I got them fixed, and now I'm good, but it took a long time, and that's why my iron also didn't get repleted naturally from food the way it should have.
Would it be more common for someone who's not eating a meat-based diet to have iron issues?
Yes, so actually we say one of the risk factors of iron deficiency is being vegetarian or vegan. Having said that, if you are well-educated vegetarian or vegan, it's fine, your nutritional health is fine. But a lot of people go and say, oh, I've watched the Game Changers, I want to become vegan, and they go for it, but they don't actually really know what's happening. They're not checking their nutritional health, they're not checking their blood works. So it's really important, if the change is made. There's so many great nutritional or functional medicine nutritionists here, dietitians, that are absolutely brilliant in giving you advice on what to eat, how to mix your food up to really get iron-rich food. If you look at spinach, everyone says, oh, spinach is so iron-rich. You look at evidence, it actually shows you need to eat 1 kilo of spinach a day to meet your iron needs.
How much volume would a kilo of spinach?
No one can possibly eat that. No one can possibly eat that. And ironically, there's a study that came out that said it's probably the dirt on the spinach that's giving you more iron. Then it's funny because Game Changers talked about B12 deficiency, which is absolutely key and important as well for vegans. Vegetarians not so much, they eat egg, etc. But for vegans, but they haven't really spoken about iron, because mostly who was interviewed? Men. And men get B12 deficient, but women definitely do get iron deficient, but they haven't really talked about that. That was not one of the aspects of the movie, which is interesting. So if you're well informed, like we get a lot of vegetarians, especially if you look at the Indian food, for example, vegetarian Indians, they drink black tea with food. A lot of them do, not stereotypical, but a lot of them do, or Malays, etc. Black tea absorbs the iron, 80% of the iron from plant-based iron. So basically they drink tea and all the beautiful iron that they've just consumed, and they know how to cook iron-rich meals because it's culturally very aware. The iron from the food goes to the tea, and the tea just drags it out, basically. It's a phytate in the tea. It's really important to, yes, you can drink tea, but not within an hour of food. Same with milk. Don't drink milk, not so much for vegans, but vegetarians, don't drink milk within an hour of food. So you really need to play a bit, ideally have a piece of fruit with it, in order to increase the absorption.
So a very simple change can have a massive difference to your iron absorption.
Indeed.
And that's a lot of what you do, is that education.
Yes.
Which could change somebody from needing to get to the stage of needing an infusion. You could nip it in the bud and then they wouldn't need.
Indeed. So you were asking as well if we've seen severe cases. We have, actually. We've seen pretty severe cases of mostly moms coming in, of women with severely, like with fibroids, severely heavy menses. There was one lady that came in, very interesting. She allowed us to share her story, obviously not her name, but her story. She came in with a hemoglobin of 7. Her ferritin was basically 1, not existent. And she came in and she did the blood test because she always, like, at 6 p.m. she had to go to bed. She was craving ice, pica, which is like a key sign of iron deficiency. So she was really at the lowest, but the doctor actually sent the nurse to run over to her house, was just next to her, next to the clinic, knocked at the door and said, you need to go to the hospital now for blood transfusion. And she was like, panicking. And funny enough, that was a Saturday, and I was looking at our Facebook account, and she started messaging us, and I was messaging with her, and she said, I'm a former nurse, do you think I really need to go for blood transfusion, or I read about iron infusions, can you do something? And then we talked about the whole concept of patient blood management, which is the objective of avoiding blood transfusions, because you give the body what it needs. You give the building blocks to build your own new blood, rather than giving you someone else's blood. And she was very much convinced, came in on the Monday, she needed three infusions in order, talking about the tank was below empty, so she needed 3 infusions in order to up her levels.
Okay.
But she was super grateful. After the first time, she was quite lethargic after the first infusion, because all of a sudden her body had this iron to work with. She was like, oh my god. So she slept for almost 2 days, but she said right away the craving for ice stopped. She didn't have to nap anymore after the first infusion only, and consecutively she just felt a lot better, and which is fantastic. Another one is just a mummy story. She came in for an infusion pregnant with number 3, bit of a surprise. She got a infusion during her pregnancy, and then she came in for another second infusion at the end of pregnancy. So she came in at week, I think 39 or just 40, just before she popped. She went into the hospital, and she had a postpartum hemorrhage. She had sticky placenta. And so basically she lost a lot of blood. And her hemoglobin dropped to 8. So we work with her obstetrician, and he gave us a very nervous call and said, you need to come into the hospital now to help us with an iron infusion, And we were saying, hang on, and we looked at her values in detail, and we said, actually, she doesn't need it, because she has all the she lost all this blood, but she has all the building blocks in her, the ferritin storage. So she has all the building blocks, and they just need to get to work. And literally nothing was given, no extra iron, no extra blood was given, and we checked her 4 weeks after the infusion, and her hemoglobin was at 13. Yes, so we gave another infusion because the ferritin was still low, because she used up all of the ferritin to make her new blood. But she didn't need a blood transfusion, not needed, which is fantastic. Luckily, we work with this obstetrician. He was open to listen, but standard care would be to transfuse.
So ferritin is the storage.
Yes.
Hemoglobin is how much is circulating in your blood.
Yes.
I see. So her hemoglobin was low because she'd lost so much blood. But her storage she had the capacity to make
top it up. So a little building man that came and basically built her little blood house up again.
So that's why it's so important to have an understanding of what does what.
Exactly.
But what about, so you as a mum, so you are a mum of 2, and you are a founder of a business here, but you're not a doctor. So what do you do on a day-to-day basis? What do you do at the Iron Suites?
So what I do at the Iron Suites, so
what don't you do at the Iron Suites?
So I'm managing all our marketing, being like, we have an Instagram account, Facebook account, our website.
This is at the Iron Suites?
At the Iron Suites Medical Center. Please follow us. Much appreciated. We're taking videos with our experts, talking about iron deficiency. I'm just in the process of setting up a YouTube channel. We're creating lots of material, being it for patients, something like what you're sitting next to, about who we are, etc.
Oh yes, I see a familiar face there.
Yes, exactly. So we have lots of little brochures so literally we're going through tons and tons and tons of medical evidence to make it really easily digestible and put it in really fun little graphics. We do that. We create material for doctors as well, which is obviously a different level than for patients, a little bit more medically written. So we produce these materials. I help with the operations here. We have fantastic staff, but I'm always stepping in here and there to help. That's what we're doing. But also, looking at the health screening. I'm also looking at the allied healthcare professionals, so who we collaborate with. So there's a lot of doulas that work with us, midwives, and physiotherapists, osteopaths, chiropractors, you name it, functional health, nutritionists, etc. So I'm working with these guys and do a lot of education there, relationship management for that.
Wow. In between being a busy mum of 2.
Yes. The good thing is, because it's our own business, I can be really flexible. In fact, we had a really fun meeting here with a journalist that wrote about us, and Mia was just 3 months old. I came fresh from baby swimming with her on me, and we sat there and had the meeting, and she's like, oh my god, I've never done a meeting with a baby. I really love it. And Mia was really happy. She's like, quiet. At the time, just sleeping non-stop still. So it was fun.
Don't big it up. That's when you say, that's because I'm a power mum. Got to get stuff done. Right?
No, it was really fun and extremely well received. I've done that a few times now. Thanks to COVID, everything has shifted a little bit.
Yeah.
So working from home is fantastic. You do your work, then your children want something. Oh, you go swimming with them. You know, Mia, I'm breastfeeding. I feed her. I play a little bit with her, and then I can work again when she sleeps.
Yeah.
It's fantastic how it works. Right?
Because typically you'd never be able to work from home.
No.
You'd
Normally,
have to be here, right?
It's not the normal, status quo, but COVID made it happen.
Well, thank you so much for joining us, and thank you so much for getting my dress code memo, because twins.
Fantastic.
When I turned up today, I just looked and I was like, am I looking in a mirror? What's happening? It's great. I love it. It makes me feel fashionable that someone else has chosen the same colours. So thank you so much for sharing your story. I really love the fact that you started a business based on a walk where you became out of breath and you realised how you could help all these other mums. So yeah, I think it's really important, and I think whenever we share something that's kind of education and knowledge based, it's something that will definitely help other people.
Indeed.
So hopefully lots of people will watch this.
Fingers crossed.
Yeah, we hope to hear more from the Iron Suites soon.
Thank you for having me.
You're very welcome.
Thank you.